The 5-year-old mother, a medical mystery that shocked the world. What if I told you the youngest mother in recorded history was so young she still slept with toys? This isn't a myth. It's a real medical case, confirmed by doctors, journals, and history. How could a 5-year-old child give birth, and why did trained doctors confirm it as real? This question is not rhetorical. It is rooted in one of the most carefully examined medical cases in recorded history. In the early 20th century, a very young child was brought to medical attention because her body was changing in ways that alarmed her family. Her abdomen was growing larger. She experienced pain. At first, physicians believed they were facing a serious internal illness. Tumors were considered. Endocrine disorders were suspected. No one initially imagined pregnancy. Medical examinations followed. Imaging was conducted, measurements were taken. What doctors found forced them to abandon every ordinary explanation. The child was pregnant, near full term. This conclusion was not reached quickly nor lightly. Multiple physicians independently reviewed the findings. Physical development, bone structure, and internal anatomy were examined in detail. The results were consistent. The pregnancy was real, it was advanced, and it was biologically possible. What made this case extraordinary was not only the child's age, but the biological explanation behind it. The child displayed a rare and extreme form of early-onset puberty. Her body had begun producing reproductive hormones years before the normal developmental window. Menstruation had occurred in early childhood. Internal reproductive organs had matured far earlier than expected. From a medical standpoint, the case fit the criteria of precocious puberty in its most severe documented form. Because of the child's age and physical condition, the delivery was handled with careful medical planning. A surgical birth was performed to reduce risk. The procedure was successful. The child survived. The infant was born healthy. Every stage of this process was observed, recorded, and reviewed. Doctors documented physical findings, surgical details, and post-delivery outcomes. These records were preserved because the case challenged long-standing assumptions about human development. The significance of this event extended far beyond a single birth. At the time, medical science held firm boundaries about when puberty could begin and when reproduction was biologically possible. This case demonstrated that, in rare circumstances, those boundaries could be crossed. As news of the case spread through the medical community, it was treated with seriousness rather than spectacle. Physicians focused on verification, not shock. The emphasis remained on evidence, anatomy, hormone activity, and clinical outcomes. No similar case at a younger age has ever been confirmed with the same level of documentation. Over the decades, this event has continued to appear in medical education and historical discussion, not because of curiosity, but because it represents an extreme outlier that reshaped understanding of pediatric endocrinology. It also raised questions that medicine alone could not fully answer, questions about care, responsibility, and the limits of biological knowledge at the time. Yet those discussions never altered the central fact. A child gave birth at an age once thought impossible. This was not folklore, it was not exaggeration, it was a recorded medical reality, examined by trained professionals, and preserved in historical record. And nearly a century later, it remains one of the most extraordinary confirmed cases in human history. The case is a verified medical reality, not a myth or exaggeration. It challenged long-standing assumptions about childhood development and biological limits. Medical professionals relied on direct evidence, clinical observation, and repeated verification rather than expectation. The findings forced medical institutions to confront an extremely rare developmental condition that did not fit existing frameworks. Strict documentation and oversight were used to eliminate doubt and ensure accuracy. The case became a historical reference point in medicine due to its credibility and careful handling. It influenced approaches in pediatric care, reproductive medicine, and ethical decision-making. Beyond science, it highlighted the human consequences, emphasizing dignity, protection, and responsibility toward a vulnerable child. Its lasting importance lies in how it reshaped medical understanding and reinforced the principle that evidence must guide knowledge, even when reality defies expectations. She was born into a quiet rural community in early 20th century South America, where life followed the rhythms of land, weather, and tradition. Medical care was distant, scarce, and often inaccessible. Most families relied on home remedies and local advice, and serious illness was met with fear rather than certainty. Childhood in such places was brief and practical, shaped by work, family, and survival rather than scientific oversight. During her early years, nothing appeared unusual. She grew as other children did, surrounded by relatives who measured health by appetite, movement, and strength. But as time passed, subtle changes began to appear. Her body developed in ways that did not match her age. At first, these changes were confusing rather than alarming, easy to dismiss in a place where formal medical knowledge rarely reached. Then her abdomen began to swell. The change was gradual but undeniable. To her family, this was not a sign of development but of disease. They believed she was suffering from a serious internal illness, possibly fatal. In their understanding, a child with a growing abdomen was a child in danger. Fear replaced uncertainty. Every passing day seemed to confirm their worst expectations. With limited options and no clear explanation, her parents sought help wherever they could. Local remedies failed. Advice from neighbors offered no answers. The swelling continued, and her strength appeared to fade. Convinced their daughter was dying, they made a decision that would alter the course of medical history. They gathered what little they had and took her far from their village to a city hospital, believing it was their last chance to save her life. It was there, under clinical examination and professional scrutiny, that the true nature of her condition would begin to emerge, marking the moment when a family's fear met a reality medicine had rarely confronted. Doctors initially suspected a tumor or severe hormonal disorder. Standard explanations failed to match the examination results. Tests revealed advanced physical development far beyond the child's age. Imaging and analysis confirmed the child was pregnant at an advanced stage. Multiple examinations and independent reviews were conducted to rule out error. Medical professionals reached an unprecedented conclusion. The pregnancy was real, and the patient was under 6 years old. The case forced medicine to confront an extreme and rare biological reality. The case was explained by precocious puberty, a rare but recognized medical condition. The body's reproductive hormones activated years earlier than normal, triggering adult physical functions in a child. This early activation could lead to menstruation and ovulation long before typical developmental stages. The condition occurred internally without influence from behavior or environment. A critical distinction was made. Biological function did not mean emotional or mental maturity. Despite physical capability, the patient was still a child in every other sense. The rarity of the condition explained why the case was shocking, while its medical recognition explained why it was possible. Doctors ruled out natural birth due to serious physical risk. A surgical delivery was the only safe option because the body was not fully developed. The operation succeeded under extreme conditions. A healthy baby boy was born. The young mother survived the surgery, defying expectations. The case became medically verified and officially documented. A historic record was set, the youngest confirmed mother ever recorded. This moment transformed the case from a medical mystery into a permanent chapter of history, ensuring it would never be forgotten. The case remains fully verified by medical evidence. It is extremely rare, far outside normal human development. Its importance is historical, not sensational. This was not a story of achievement, but of biology acting beyond expectations. Circumstance, not choice, shaped the outcome. The case leaves unanswered questions that still challenge medical understanding. It is remembered because it forced science to observe, document, and learn, rather than look away. Lina Medina's case is the most well-documented example of extremely early motherhood due to a rare medical condition. It remains one of the most astonishing and somber medical cases in recorded history. Subscribe for more interesting history, and don't forget to like and comment.